about us. Think about you.
Hello, hello. We got Roel. Let's see here. Roel's on YouTube and Instagram. What's going on? I'm gonna wave at Roel again. If you're with me live here, we're taking questions on Instagram, Facebook, YouTube, LinkedIn. I see Jerry's in the building. Foxy Moxie, hello. Thank you for your question. Lisa, what's going on? Great to see you. I hope you're feeling better. I hope everyone is doing wonderful tonight. DB Kenton, what's going on? Thank you for being here tonight. We're going live. We're answering questions. Sorry about that. If I can hope my phone doesn't mess up there. Come up with your question. Okay. Edna, what's up? Elena, what's up? Great to see you. Who's in the building? If you're new here, let me know where you're from. Carter, what's up? Yes. I love this hat. Carter, how cool are these hats? Steve, what's going on? Great to see you. Hope everyone is doing wonderful this evening. We're going to have a fun time tonight answering health and wellness questions. Carter, are you on the golf course? Are you golfing? Man, tonight would be the perfect time to golf. You cannot ask for better weather than what we have right now. So if you guys are watching, I hope you're outside. I hope you're doing something fun. We're going to probably get outside after the show here in a bit. Let's see. Okay. Weather's beautiful. Gosh, it's got to be 62. It's got to be 62 right now in Tennessee. Girl, Mary, happy Tuesday to you. Thank you for being here as always. Thank you, Tom. And I don't think I've benched against bands. I've seen that before, but I've never done that. I don't think there's like a rebound effect that I know is helpful, but I haven't tried that. Danny, what's going on? All right. Some BH chicken wings. I dig it. I love that question. Thank you, Steve, for that. Let's see. Got anybody? Let's see if I'm missing some comments. Thank you, guys. If y'all have a question for Doc, go ahead and put it in the comments real quick. I'm going to put this up. And let's see if I can find it. Let's see. New episode of The Common Sense went out today. If you haven't seen it, this is my sister right there, Kelly Rogers, our licensed esthetician over in the Johnson City office. Skin Health Essentials. This is what Dr. Rogers does for his own skin, as well as what Kelly recommends. Goes over kind of like the foundational type stuff that we think everybody can be helped by. They talk about vitamin C. They talk about retinol. And then they get into some of the more, advanced stuff like the RF microneedling and old therapy. Super, super fun episode. Shout out to Kelly, my sister, for doing that episode with Doc. And then this one, I see Tom saw this one. That's Bo McGregor right there. He and Andy Rogers, my brother, talked about kind of what Bo's doing right now. He did an in-body scan before and after. I don't think Bo would mind me telling you guys he's on, and if you watch the episode, he's on testosterone. He's on tirzepatide, like a microdose of tirzepatide, and I think a little bit of sermorelin he mentioned. But he goes over how he's actually lost weight, gained muscle, which is something we talk a lot about with the GLP-1 GIP medication, the drug class, and that's how it's supposed to be. You're not supposed to lose muscle on those medications. And if you guys have questions around that, ask Doc when he comes in. Let's see here. I'm missing. That's awesome, Roel. Yeah, the protein thing is huge. It's such a big deal. What's going on, man?
Hey. No worries.
I see Brookhaven's in here. Brookhaven, what's going on? Jake, hello. Yes.
Shout out to Brookhaven.
Shout out to Brookhaven Farms.
I like my new hat. Do you?
I love my new hat. I think they're so cool.
Anna, I just ate a Brookhaven hamburger.
How good was it?
Oh, fantastic.
Was it the best?
Fantastic.
It's the best.
I'm thinking about going total carnivore.
How would you
total
go?
Carny.
What would your day look like going totally carnivore?
Be a lot of meat.
So would
Am I
you?
supposed to be using this?
Yeah, we need to. All right, guys, we're on the podcast.
Okay. Yeah, I'm thinking about going total carnivore.
What would that?
I've done it a little bit before. I had a patient today who has done it, and just in 2 weeks, she has lost about 15 pounds. All her joints quit aching.
In how long? 2 weeks?
2 weeks. Yeah.
Dang.
Maybe 3 weeks. 3 weeks.
That's incredible.
Yeah.
Beef
Yeah.
or chicken or both?
All
of
you
it.
know, more
Eggs?
beef, eggs, chicken, fish, just no carbs.
Do you think you could do like you have to prepare for that? You can't just like say I'm going to go carnivore and not plan out like your whole week.
You really would have to plan.
You'd have to plan it
Yeah.
out.
Yeah. I wouldn't say it would be easy, but I suggest trying it for a month. That's what I'm going to do.
You gonna try
and
it?
just see. Yeah.
Only
1 month.
only animal products. So eggs. Could you do
Cheese.
cheese?
Maybe some aged cheese. Maybe.
Raw milk from Brookhaven.
Yeah.
Okay. Raw milk. Beef, chicken, fish. I know you like fish. Eggs. No carbs.
Beef and more beef. Yeah.
Beef jerky.
They had an article in the journal about it last week about these babies that are being raised as carnivores.
I wonder how they're doing. Like, well, I guess you wouldn't know that.
Well, apparently good so far, but the pediatricians don't like it, you know. And they made one valid point that you need vitamin C. You need a supplement with C if you just do total carny.
Well, you have to go
and more fiber just for bowels. But meat does not have vitamin C in it.
Huh.
Uh,
So you have to supplement with vitamin C. You'd have to. What would you do for fiber? Just take like a Metamucil or something.
Metamucil,
Yeah.
Benefiber, something like that. Yeah.
You know, it's so funny. I live in my grandparents' house where Dad grew up, and I cannot even say Metamucil without thinking of your dad.
He drank it every day. He was a surgeon, a colon surgeon, and he drank it every day. So did my brother.
Yeah. He loved Metamucil. Let's see here. We got some questions coming in. Thank you, guys. I see Jay Covers in the building. Jay Cover, thank you so much, man. These hats are the bomb. This might be my favorite one.
This is definitely my favorite.
Yeah, I think it's my favorite one.
Yep.
All right, I see Jerry's question. I see Jax in here. Jax, what's going on, man? Been keto for 2 years. That's awesome. All right, we're taking questions. Thank you, Roel, for watching the episode with Andy and Bo. We got people here on Instagram. Guys, we're watching Instagram as well. If you guys have questions, put in the comments. I did not see a question come through email, so we're gonna go live the whole time. So if you have a question, go ahead and put it in the comments. We're gonna get to everyone tonight. If you're outside, let us know. We're gonna kind of live vicariously through you. If you're outside in this beautiful East Tennessee weather, or wherever you're from. I know, I think Foxy Moxie's up.
Feels like fall, doesn't it?
Feels like fall.
Yeah.
I heard Amanda was telling me how there's a phrase called Ogtober.
October.
Like August, but
Where you
October.
skip September?
But October, like where it's August, but it kind of feels like October sometimes.
That's what it feels like.
It feels like October to me.
Yep,
It's
it
wonderful.
does.
All right, let's see if we have questions here. I will should get to all of them. Let's see if I can find one. Okay, let's get to Steve here. Again, we're going straight into live questions. So if you have a question, go ahead and put it in and we'll get this show going. How are you diagnosed with metabolic syndrome? What numbers and tests? And I'll get some context for you, Doc. Steve, I don't know if you watched the episode with Andy and Bo McGregor on Explain This today, but they talked about how, more people than we think have metabolic syndrome.
Yeah.
How do you actually diagnose it? Is it something you can diagnose?
Of course. Yeah, it's really easy. They used to call it Syndrome X. Now they call it metabolic syndrome. And really, it's comprised of insulin resistance, high blood pressure, hyperlipidemia. So those are the main things, maybe high triglycerides in particular. But, and some people think a high uric acid gout is part of that metabolic syndrome. But it's basically insulin resistance, which leads to all the other problems. Obesity, diabetes, hypertension, hypercholesterolemia. So, and just look at the numbers. Really, if you get a Cleveland heart panel, everything's there to diagnose it. A real nuanced look at your lipid status, including the particle size, the ApoB, the LP little a, oxidized LDL, the map of the particle size, and you have your insulin, C-peptide, insulin resistance number, of course, along with an A1C and the glucose level. And, you have your uric acid level, your cortisol. A lot of things play into part with this. But, it's really easy to diagnose. And if you think you have it, you've got it.
Is there anything that, like, any symptoms, or other than maybe obesity? Is there any others, like being tired or something like that? Belly fat, probably?
Belly fat, being tired, sugar fluctuations, inability to even handle carbs. You want to, have you worn a Stello and seen what your carbs
I have not, but I need to.
What carbs do to your glucose levels? Yeah, everybody should wear a Stello
So when you say handle it, like if carbs were to spike me immediately, that would say I'm
insulin resistant.
I'm insulin
or if it bottomed you out. A lot of people think hypoglycemia is the opposite of diabetes, but actually it's a precursor to diabetes. Because you have too much insulin and and at first it bottoms your sugars out because you're too reactive to it. And then your insulin just loses effectiveness and boom, you're diabetic. Remember, insulin's a fat storing hunger hormone. So that insulin level is really important.
That's super interesting. Steve, does that help any? I know that's one, such an important question, and we talk about metabolic syndrome so often on this show and all of our shows. So I hope that helps a little bit. Let's see, Robin Riddle's in the building. Robin, what's going on with you? So good to see you. I saw you last week. I hope you had a blast at the concert. Let's see. We got Angie in here. Angie, what's going on?
Angie.
Jake, there you go. I love it. Let's see. I see Leah's in here. Thank you, Leah, for the question. Teresa, thank you. All right, we're going to keep moving here. I see some people on Instagram as well. We're taking questions over there also, guys. And now I'm hoping I can find where I was at. Thank you, Steve, for that question. Let me know if that helps at all. Let's go to Helen. I believe this is not a question. Carnivore is more difficult than it seems, but there's a gal who has a Facebook video showing how to eat out with only carnivore. Helen, let us know what that is. We're going to need all the tips we can get for Doc here about how to do it while eating out, because I eat out a lot.
Yeah,
I like to eat out. Let's get to Jerry. What's your thoughts on cayenne supplements for pain? I think it's good for cancer too, which I need also. How many would you take a day?
Yeah, cayenne pepper, which seems inflammatory, is actually very anti-inflammatory. So it's really an essential ingredient in most of the pain supplements. I'm not sure how many milligrams, but 1 to 2 a day. But yeah, it's a very overlooked supplement that really works well. Sometimes we used to use it for post-herpetic neuralgia. After you have a case of shingles, after the rash has gone away, using it for that neuralgia, the neuritic pain. You don't want to put cayenne pepper on there when you still have the rash broken out. I've had a few people do that mistakenly, and it really lit them up. But yeah, great little supplement.
Jerry, I hope that helps. Thank you for that question. Jerry's over in the UK. I'm jealous. I love it. Tom's saying it was 45 in Bluefield this morning. Dang.
45.
God.
Wow.
In August. All right. Teresa is asking, is there a correlation between having a thyroidectomy and increased fasting blood sugar / A1C? Mine went crazy after having my thyroid removed back in March.
Yeah, there can be. There's a little triad that I draw for people when I first see a patient that has a thyroid problem. And I explain to them that there's really 3 glands that secrete hormones that control your metabolism, basically. and it's your thyroid gland, which controls your basic metabolic rate. It's your cortisol, the hormone put out by the adrenal stress hormone, and then you have insulin put out by the pancreas that regulates blood sugars. So these three glands and those three hormones talk to each other by a negative feedback loop. So minute to minute, they're communicating with each other. So say if your thyroid's removed and you haven't got it really, you're going to have to get on some thyroid hormone. It really jacks up your cortisol and your insulin levels. So you don't get that conversion of T3 to T4. So yeah, it can take a while to really calm that whole system down. It really definitely can. So definitely wear a Stelo continuous blood glucose monitor and look at it and get your thyroid, doses all settled in, which may take a while. It takes a while.
Yeah. That's a great question, Teresa. If there's anybody in here that has been a patient of Doc's, on the back of a lot of charts is that triangle.
Write that diagram. Yeah, it's a triangle. A metabolic triangle.
Yeah, I love it. Thank you for the question, Teresa. Okay, let's keep moving here if I can find it. Let's get to Leah here. Leah's asking, are the capsules any good for Metamucil? Okay, so there's a Metamucil question.
Yeah, as long as you drink enough water with it. Yeah, I'm good with that. A lot of people prefer that. Metamucil doesn't taste that good. You can get the orange and all. It's a little gritty.
Is it?
As long as you drink enough water, I think it's fine.
Is there any other way to get fiber that's better other than your food?
Mostly food, but then you can't go carnivore and get as much fiber as you may want.
So if you go carnivore, are you going to start taking Metamucil?
Maybe.
Okay.
Maybe. I'll see. I don't have a problem with constipation.
Okay.
But, perhaps.
All right. Thank you, Leah, for that question. Let's go to Roel. If I'm on 200 milligrams of testosterone intramuscular, I am 100 a week, but go to a cream, would the dosage be the same? No pellets because of my job. What's your thoughts on this? I hope I read that right, Roel.
Yeah. So if you're on 200 a week or 100 a week?
I bet that's 100 twice a week, Roel. So 200,
probably
100 twice a week.
Dose up, which is really the best way to do it. Number one, if you go to a cream, you're probably going to be disappointed. Creams work great for women, not as well for men. But I usually start out at 100 milligrams a day on testosterone. Somebody like you that's on a fair dose, moderate dose of testosterone, and just see how you feel, check labs and see where you are with that. But you're probably not going to get the feeling that you do on the IM. I just don't think you will.
Roel, did I get those numbers right? I see you put in 100, but that is right, 100 twice a week with the shots, and then you're saying for the creams you go 100 a day.
Yeah.
Okay.
Yeah. It's a lot less absorption.
I love this actually from Steve. I use a psyllium husk for fiber. Yeah. That's awesome. Mm-hmm. All right, let's keep moving here. Thank you guys for all these questions. Let's get to
hemp seeds too. I think hemp seeds work good. I love hemp.
You do love
seeds.
Hemp. Yeah.
Not the type you smoke, but the type that comes in seeds.
Actually, I kind of dig this quote. Everyone should know that most cancer research is largely a fraud. Linus Pauling. We're fans of Linus Pauling, big vitamin C advocate. Thank you for the quote there. Let's see here if I'm, let's get to Megan here. Thank you, Megan. Protocol after gallbladder removal, supplements, medications do you recommend?
Yeah, after you get your gallbladder removed, you may have a lot of loose stools, diarrhea, because you don't have any bile emulsions to kind of break up that fat. So what I recommend is Digest Shield. because it has digestive enzymes. That's the part that you need. So expect a little, getting used to it, period, as far as after your gallbladder's removed, because a lot of your bowel function will change. Sometimes not, but most time, yeah. So I love Digestial.
Yeah.
It has everything in it, including digestive enzymes.
Would you say take Digestial twice a day with 2
Oh,
meals?
for sure.
Okay.
Maybe even 3 times a day if you eat 3 meals a day. But, it's really important after you have that gallbladder done to balance your gut. And it's going to take a little bit of doing experimentation. You may have problems with fatty meals. That's why you need digestive enzymes. Like mostly are there to break down fat.
All right, Megan, thank you for that question. I hope that helps. Let's get to Elaine over on YouTube. What can you take? What can you take before or after a workout to prevent soreness? And do you recommend protein shakes?
Yeah, I like protein shakes as long as they're not soy based, like some of them you'll see. But there's a thing you can do. Really, what works good is baking soda.
Interesting.
A lot of athletes are using that. It's totally legal.
Like put it in water or something?
Yeah. The only problem with it is because really what causes soreness is lactic acid released by your muscles when you work out, hard workout. And so it kind of changes the pH of your body. It lowers the pH, and baking soda it's more alkaline, so it raises your pH. A lot of endurance athletes do that. I bet you anything, almost every Olympic middle to long distance runner is taking it. There's a company in Switzerland. I've ordered some
baking soda
pills.
Okay.
Yeah,
Okay.
They're specially formulated because the problem with just mixing it in water and taking it, it causes a lot of gas and upset stomach. When you're competing, you don't want that. So there's a company in Switzerland that's kind of worked it out somehow. I ordered some, and I ended up giving them to my brother who was running marathons. And
did it help him?
He wasn't sure.
Okay.
He didn't have a really good opinion of it.
Okay.
One way or the other.
Okay.
But yeah, that'd be the main thing I would think about doing. And then, of course, cooling off, taking a nice bath. That works good. I like my infrared sauna. I like red light therapy. I like natural anti-inflammatories like curcumin, MSM, kind of like pain formula. That's what I take. It has all the stuff in it, plus boswellia. So there's a lot of stuff you can do. Drink a lot of water too.
Would you take the pain formula for soreness?
Mm-hmm. Yeah.
I've noticed, and I'm working out more now than maybe normal, but like I get sore pretty easily. Maybe I'm getting a little older, but
That's funny.
You're sore all the time.
I
You're in the morning.
I stay
You're stiff.
The only thing that bothers me about being 70 years old is stiffness and soreness.
Really?
I play pickleball for 2.5 hours. And I go at it when I play it. I'm really sore the next day. The rest days are as important as the exercise days. I think, you just got to recover. If you don't recover and you stay inflamed all the time, it's worse than, maybe not worse than doing anything, but it's really bad for you. You don't want your body in a chronic state of inflammation.
Yeah.
The biggest group, the group of people that I've seen that work out the hardest and for too long is women in their 40s that are gym rats.
Yes. Yes.
They work out harder than NFL players.
Really?
They really do. Yeah, they spend more time in the gym. They'll go from bar class to spin class to
and it hurts them?
Weight training. Yeah, when they're fit looking, but they're chronically inflamed and they get chronic fatigue and they hurt all the time. A lot, not all of them. A lot of them do. I've just seen that. Now you can get too obsessed with it.
Yeah.
To be honest with you.
you can like over exercise as almost like it's almost like anxiety coming out in
Yeah.
like a healthy way. I mean,
Yeah.
it's better than,
Yeah.
smoking
You're right.
cigarettes.
A lot of people do it for the mental aspect of it. But protein shakes, I don't do a lot of protein shakes anymore. I do perfect aminos because it's already digested. The problem with protein shakes is a lot of times you won't get the absorption that you really need. Better to eat real meat, I think.
Let's see here. Let's keep moving, guys. Thank y'all for these beautiful comments. Katie, I see you. Thank you for being in here tonight as always. Let's see. I got to Megan. Thank you, Megan. There we go. Angie's question. Okay. Angie's question is, I'm 62 and I've had frozen shoulder 3 times in 7 years. Could this possibly be a hormone issue? Doc, real quick, what is frozen shoulder?
That's where you've just had a lot of mini or major tears, and because it's hurts to move it, you don't move it, and it becomes frozen. All these adhesions form. And I've seen them go to the ER, and the orthopods will just put you asleep and then just move it all around and manipulate it. They
Almost
don't
like bring it
do
back
that
to
much.
life? Kind of?
They just break up the adhesions through manipulation, not cutting on you. They're just putting you asleep because it's so painful. It's unbelievable. They don't do that much anymore. But yeah, I find that women, especially that get on hormones, their joints feel better. So if you're a 62-year-old woman and you're not taking hormones for some reason, you need to have that evaluated. There's a whole generation of women your age that are scared of hormones because they cause breast cancer, which they don't. Bioidentical hormones do not cause breast cancer. Really even Premarin by itself did not cause breast cancer. There was less breast cancer in the women that took a pregnant horse urine estrogen alone than the women that didn't take anything. And when they added medroxyprogesterone, which we never use, it's a really bad synthetic hormone. Think birth control pills, Depo-Provera. Even with that, with the combination of Prim Pro, which, if you have a uterus, you can't take unopposed estrogen. So when they did the studies on the Prim Pro, for women that you had, the amount of breast cancers went from 4 women per 1,000 on nothing to 5 women per 1,000 that took Prim Pro.
And that's still the
even
synthetic
with
version.
Prim Pro, nobody would use that now. They know what they're doing. So it's very safe. And yeah, I found it to be very helpful for joints. It really isn't. The other thing you might try is PRP. I've had that done on my shoulder. Really helped a lot. And physical therapy, of course. It's a tough frozen shoulder's a toughie.
Angie, let us know in the comments if that helps. That does, it seems, I didn't even know what that was, but it sounds miserable. Thank you, Angie, for being here tonight. Real quick, I'm going to put this up from Robin Riddle. L-glutamine is great for soreness and the gut both.
Yep.
Thank you.
Yep.
Yeah. Great.
I think after a workout, mostly.
Thank you for that, Robin. Great comment there. Let's see here. Oh, let's see. Tyler's in here. Tyler, what's going on, man? Large volume injection fixed the frozen shoulder. Went to Vanderbilt Orthopedics for my injections, and I'm fine now. That's amazing. No surgery needed.
Yeah, he was about to get surgery. I know.
Really?
That. Yeah, he was on the cusp of surgery.
Now, how big of a deal is it to not have to do surgery for that versus the way Tyler went about it?
Much rather not have surgery.
Yeah.
It can create more adhesions and more problems.
Yeah. That's interesting. Tyler, thank you for that comment, man. That's awesome. Okay, let's keep moving. Hey, Lisa, I see you. Great question. Thank you, Diane. I'm on compounded hormones replacing now 18 years. Ladies, it's great. I love it. Clean.
What did Robin say about use of, if you're a woman, use of hormones? That was a great quote. I need to write that down.
Robin, if you're still here, because I told Robin, I'm like, first of all, can I quote you on that? Because there was something about the way she said it that just like, man, I know that is like, that just hits every part of what we're trying to do.
Only 5% of U.S. women, eligible U.S. women, are on hormone replacement. 5%. It should be 99%.
This is Robin Reel's quote. It was in one of our Explain This episodes, and she goes, menopause makes everything worse. That's why we treat it. I love it.
That's a great statement. Yeah.
And by treating it,
With hormones.
talking about hormones.
Yeah.
Thank you, Diane.
So much misunderstanding about hormones. If you're a woman, a middle-aged woman, the earlier you treat it, the better, but you're doing yourself a big disservice if you don't seek a knowledgeable practitioner out who knows what they can do, because it can change your life for sure.
Yeah.
There's no doubt about it.
You told me there was a patient that was in the Kingsport office, and I think they said that something about like hormones fixed me or something like along those lines. Was just feel like myself again.
Yeah.
Let's put this up from Karen because I love this. Speaking of muscle soreness, Dr. Rose, don't forget you got a couple guest passes.
Thank you, Karen. She gave me a couple passes.
Karen, I got to get him there.
I gave one away to a patient that day who was very asked me about Orange Theory. I go, well, hey, one of my great patients gave me a couple of tickets, so I'm definitely going to use the other one that I still have in my office. I know Fran and Gary, they go all the time.
My wife Amanda, when she lived in Johnson City, went to that Orange Theory at like the 5 a.m. class pretty religiously.
5 a.m.
Yeah, she and her sister love that Orange Theory. Thank you, Karen, for that reminder. We got to remind Doc to get in there. All right, let's keep going. I see Jay here. Jay, what's going on YouTube? Have you heard of the GLP-1 called retatrutide? I've read that it not only helps you lose weight, but it helps you gain muscle. What's your thoughts on this?
Well, that's the theory. It's not FDA approved yet, but yeah, we call it triple G. It'll be the next one that comes out. By the way, J34 has a very nice son.
Yes.
So polite.
That's amazing.
Impressive.
That's amazing. Jay, that says a lot about you. Whenever you have just a super, amazing, polite son, you must be a great dad, man.
That's exactly right.
Yeah.
He is. You could tell. But yeah, it'll be out. It may be the next big thing. Lilly's, one doing all the studies. It's not FDA approved yet, so you can't even get a legalized compounded form of it yet. If you see it advertised, which you will, don't do it yet because there's a little bit unknowns about it and you don't know where it's coming from. So, it needs to be FDA approved. It doesn't mean you can't use a compounded version of it. But I know there's people out there selling it, but I wouldn't trust it. And definitely, we can't promote it until it's been FDA approved.
Yeah.
So, but stay tuned. It may be the next big hitter. I truly believe that the GLP-1 GIP combination that you'll find in Mounjaro, Zepbound are the most important medical drug since I've been practicing. Certainly in the 21st century. Yeah. To me, it's the most important drug we've come up with this century. It's that good. Not everybody can take it, but most people can take it. But it's along those lines where you change people's lives with it. They come in and say, I feel normal again after 20 years of being obese. Yeah. So
is it a bad time to kind of address some of the lawsuits around Ozempic?
No. There was a thing in the paper not long ago, one of the journals, about causing, and I think Bo talked about this.
Yeah, Bo did a piece of content
an
on
eye problem, maybe even partial blindness. But if you look at the study, it wasn't really. It was, number one, it's very, very rare, and you always have to balance the risk benefit ratio. But the group of people that this happened to were not random. I mean, those people had metabolic syndrome, diabetes, most of them, who are prone to having diabetic retinopathy. They're prone to eye problems in the first place. So not that it can't happen, it could, but it's very rare that it would cause that.
One thing Bo said was just this common theme of insulin resistance being in the whole middle of all this, because people get on Ozempic for diabetes a lot of the time, obviously, and people with diabetes have insulin resistance. Is that kind of the,
Yeah.
are they blaming something
It
that's
may be a population predisposed to that condition anyway. And it could, rarely push them over a little bit towards that.
Yeah.
So it could.
Yeah, super interesting. Like, as always, we're going to keep talking about it. We're going to keep, as things come out, we'll talk more about it. But, I totally get people who they make comments how like it's a scary drug and stuff like that because they see highlights like that. You know?
Yeah. They get scared of it. So,
but like Bo said, and like you always say, it's about weighing the risk versus the benefits. And I think you would say too, Bo said that the risk of the things that can come with diabetes is worse.
Way more prevalent than having an eye problem with it.
All right, we're going to keep moving, guys. Thank y'all for all these amazing questions. I hope I get to everybody here. Let's see, Cheryl, this is amazing. Just got my hormone pellet last week. Feel 1,000% better with it. That's awesome.
Love that.
Thank you, Cheryl, for.
Thank you, Cheryl. 1,000%. I like that.
I like that too. That's better than 100%.
It's way better. 10 times better.
Let's see. Let's go to Mark here. Mark, thank you, brother, for being here as always. The first human case of a flesh-eating parasite screwworm infestation has been confirmed in the U.S. Authorities have said the risk to U.S. public health was currently very low. Any thoughts on this? I had not heard of this. What's your thoughts?
I haven't heard of that either, but I don't want it. I don't know.
Yeah.
I don't know. Sometimes you got to take that with a grain of salt when CDC puts out something like that. Who knows? I mean, do you trust the CDC or the FDA? Well, you didn't say yes or no. You just nodded your head. Maybe now we can trust them. We're finally getting some people in there who are shaking it up a little bit. So I hope we can trust them. We need to be able to trust them, especially when it comes to things like food poisoning and things like this. But yeah, I haven't heard that. Gosh, I hope it's not, something on the horizon, but you always hear stuff like that. Ebola is going to be everywhere and all that. I mean, look at what they did with the COVID epidemic. They overdid it. Not that it was not terrible, it was, but they created a paranoia that people were afraid to, pass somebody on the street.
Yeah.
Or you see people riding down the creeper trail with a mask on. I mean, so you can create a lot of paranoia about it. And so I really don't want that to happen again, but it will.
I want to get to Pace Mama here. Is the question around, is it bleeding hemorrhage, Pace Mama? How was the best treatment for, I'm seeing, if I can read it right, hemorrhoids without surgery?
Hemorrhoids?
Yeah, maybe we can start there.
Yeah, they don't do hemorrhoid surgery as much as they used to. I've even cut a few hemorrhoids out in my lifetime on some patients. But hemorrhoid is just it's a varicose vein that gets a blood clot in it. And it becomes very painful. Usually a result of constipation, pushing, strain, that type thing. But there's a lot of things that work really well for it. One of the best things that works for it is nitroglycerin paste.
Huh.
I use a lot of the compounded stuff. You can try preparation H. It's mild, not going to hurt. Tux, some of that stuff. I usually want to cool it off with some cortisone creams too, as well. But nitroglycerin compounded with cortisone paste is a pretty good treatment for it, especially if it's external hemorrhoids. Internal hemorrhoids, which aren't popped out yet, can be treated with something called a rectal rocket. That's a suppository that you use. It has 3 or 4 things in it, mostly meant to kind of quell the inflammation down. But they can be tough.
Pace, did that help? I hope I read that right. Okay. What are the name? What's the names of what you just said for
nitroglycerin paste?
Nitro.
Yeah, most of the compounding pharmacies are gonna are going to be able to compound something
Okay.
for that. Just ask them for the Ben Rogers special butt paste. That reminds me, this is a joke. What? He never laughs at my jokes.
That was pretty
If
funny.
anybody thinks this one's funny, let me know, because he thinks I'm an old geezer. It's not funny at all. This is kind of off color a little bit, but
Okay.
what do hemorrhoids and Porsches have in common?
I don't know.
Pretty soon, eventually, every asshole is going to have one. Even though I have a Porsche myself, I love Porsches. See, you got to admit that's pretty funny.
That's funny. Cheryl thought it was hilarious.
Cheryl thought it was good.
Cheryl thought it was funny.
Okay. I shouldn't have said that off-color comment. I'm sorry, but it was too good to pass up.
Hey, we have fun. We have fun here too. I see. Thank you, Helen. Helen's jumping off. Thank you for being here, Helen, tonight. Okay, we're gonna keep answering questions, guys. Let's get to Barbara here. L91 and LDL 192. What do you think? Do you need more context?
Yeah, LDL.
LDL
Your cholesterol lipid numbers, is that what you're?
might be an LDL and maybe an HDL.
An LDL of 192 is pretty high, if that's what you're talking about.
Barbara, can I get?
I thought at first you were throwing out a peptide or something.
I see here.
Oh, here's the first part.
The cholesterol total is 298. Doctor said I need to go on statins. Triglycerides 58. HDL. So it must have been HDL 91.
Yeah. So you got a great HDL, the good kind of cholesterol. You got a high LDL. But we really break it up a little further. We do an oxidized LDL. If you get a Cleveland, you're going to have a lot better picture of it. The other thing we use is an ApoB and an LP(a), as well as measuring the particle size. But that's an inherited thing that you have with the LDL. Probably it's nothing you're doing or eating for sure. And a low cholesterol diet never works because your liver starts cranking out more. I don't use statins like most doctors do. So I know they're going to push a statin on you. And certainly if you had known coronary artery disease, I'd probably use a low dose rosuvastatin on you, probably. Maybe just to cover my butt, if nothing else. But, if your CT calcium scoring looks good and you have no evidence of heart disease or any other risk factors, I wouldn't treat it. That goes against the grain, but you got to consider the risk and the side effects versus the benefits.
Yeah.
Here's a statistic to remember. If you took 1,000 people with known coronary artery disease and you put them all on a statin, it may save 1 out of 1,000 from having a non-fatal heart attack. So, there's a myriad of side effects and complications you can get from statins as well. So I don't push them. I look at each individual case, and sometimes I will use them. For example, if you've had a stent, or bypass, but I'm not as keen to use them. Really, but I know doctors are taught to use them, and they get indirectly kind of penalized for not using them.
Yeah.
Monetarily. That's a dirty secret, but it's true.
Yeah.
So I think if you don't have any other risk factors, you're doing great. I wouldn't put you on it, but that's probably going to go against what your doctor is going to say. There's other ways. The problem is not cholesterol, it's inflammation and insulin resistance. That's what causes heart disease.
Barbara, let me know in the comments if that helps. And then I see over here, Afro Brain has a great question, and that's perfect. That's the type of, we answer health and wellness questions on this show. The question is around, can you explain Ozempic and why no one explains the black box label? And that's a great comment, around, because a lot of people are in fear over, the black box label.
When you're prescribed it, you should tell your patients, what could possibly happen as a side effect.
Yeah.
And certainly when you get it filled, it's going to be written down as well. Your pharmacist goes over that with you. Should. So it's important to know. I mean, I've only seen it cause one case of pancreatitis, which as soon as they stopped the medicine went away, but it could cause pancreatitis. Rare. But if you do take Ozempic, the main thing I tell people is if you get severe upper abdominal pain after you take it, stop it.
Yeah.
Let somebody know. We'll check an amylase lipase if it's flared up your pancreas. Certainly, that's why we don't use it anybody who's had pancreatitis in the past. Just don't do it. Unless it's gallstone pancreatitis, you've had your gallbladder removed, then it's okay. There's another warning about if you've had a history of medullary cancer of the thyroid, you don't want to take it because it was seen in one rat, never a human, as far as I know. And again, medullary cancer of the thyroid is so rare that most surgeons go their whole lifetime without seeing a case of medullary thyroid cancer. Then you got MEN syndrome number 2, which is a host of endocrine cancers, carcinomas, and you don't want to take it if you've had that. So those are the big things. And you may warn them, hey, if your eyesight starts going, stop it, let us know. So you always talk to your patients about possible side effects.
Yeah.
And, if patients should always ask.
Yeah.
And some patients are so paranoid, they won't do anything, which is fine. I go, okay, let's use some berberine, So you have to kind of know your patient. Some patients are just not going to do it.
Yeah.
So, which is fine too.
Yeah. No, I appreciate the comment. Afro-Brain, they're saying that their mother got neck cancer tumors from Ozempic, and man, I hate that. And like we always talk about, you got to be careful with anything. You got to be careful with any of these drugs, and certainly weigh out the risk versus the benefits.
Yeah, you do.
So,
yeah,
Afro-Brain, thank you so much for that comment and the question. Katie, I see you. Thank you for being in here tonight. All right, let's keep moving. We're going to answer a few more questions. We got a few more minutes with you guys this evening. Let's get to Jerry. Does fenbendazole paste used topically work the same as ivermectin topically?
It's a good question. We use ivermectin topically for different things. It's not going to work for COVID or cancer or anything like that. You need to take it orally for that. But we have been successful using ivermectin topically for a lot of things, like rosacea, of course, scabies is indicated for. Fenbendazole we use more for cancer patients. It's an anti-parasitic as well. But and usually when I have cancer patients, which I always recommend do what your oncologist says, But in addition, I use a combination of fenbendazole and ivermectin. I hit them with both that, along with some other kind of adjunctive type treatments. It seems to work. I had a patient today that's really responding just great with. He has metastatic colon cancer, or had it, and he's been on those for 6 months plus IV vitamin C, and some other things like milk thistle. I think he may be taking Tudka, some of the other alternative things, and no evidence right now of any spread or anything. He's got remission. So,
Jerry, I hope that helps. Over in the UK, let's get to Helen over in San Diego, I believe. Supplements for kidney repair /health. Chemo has been stopped due to kidney function. What's your thoughts here for Helen?
The main thing you want to do for kidney health is make sure your sugars are controlled and your blood pressure is under control. You don't take any non-steroidal anti-inflammatories. Berberine is one that I think about when that situation comes up. But yeah, I hope that comes back. That's one thing you got to be really careful for with any chemo or even any alternative treatments like Fembin and ivermectin. Always keep an eye on blood work, including a CMP, which tells kidney and liver function. Every 3 months, if I put somebody on it, every 3 months I need that lab work done.
Okay.
Just dirt cheap CMP, complete metabolic panel.
Helen, I hope that helps. Thank you for. You might have already left. I hope you get to see this, but if not, we'll talk about it again next week if you're here. Let's go to, let's see, Diane's question. Assuming this is tirzepatide for belly fat at 68 years old, is that safe?
Yeah, just like we've been talking about, there's always risk versus benefits, but it does seem to, even though it's hard to spot reduce fat on any part of your body, it does seem to help that type of fat because it's mostly carb related, in my opinion. As you get older, that's where it goes. I know as a 70-year-old man, if I gain 3 pounds, that's where it's going, right around the middle. Your pant size changed a little bit.
Yeah.
But I like tirzepatide. I really do. I take, as you know, if you watch my podcast, I take a microdose myself. I'm not doing it for weight loss or diabetes. I'm doing it for inflammation, longevity, prevention. But I have noticed it's leaned me up a little bit. On a guy like me who weighs 165 pounds, 2 pounds.
Yeah, it's a big deal.
Is a lot.
Yeah. Diane, thank you for this question. We're going to keep moving here. I see Bryson on Instagram. Hope you're still with us, Bryson. I apologize for taking so long. I broke my ankle and had reconstructive surgery, and it still doesn't feel right, especially while I train. We might need more context for this with Bryson. Have you seen anything with reconstructive surgery on the ankles? Obviously that's a big deal.
Yeah, one of our nurses just had a year ago had a total ankle joint replacement, which is a toughie. Doing great. Glad she did it. But still, it's stiff, hurts, wakes her up at night, once a night. It's a tough surgery.
Yeah.
Foot and ankle's tough. Takes a long time.
Yeah.
Especially if you got a little age on you. It's a tough one. I hate to say it will never not bother you, but that's possible. You need some good physical therapy, wear good shoes, let it heal. Don't do too much too soon, but it's going to take at least a year before you can judge anything. Feet and ankle is tough.
Is it because there's so many bones down there?
Yeah.
It's just got to be complicated.
It's so many bones and ligaments holding these little bones together in the mid part of the foot. It's just tough, because you got all that weight going on those tiny bones.
Yeah. And
a lot of times your arch will fall as you get older, put pressure on those little tiny ligaments that hold them together. It's a toughie. Don't lose. Probably if you're fairly young, you're going to get better. It's just, you got to be patient with it.
Bryson, I hope that helps. We're going to keep moving here. I see Lisa's got a great question. Thank you, Lisa. I hope you're feeling better. Does berberine help PCOS / PCOSD? Update in physical therapy for Achilles tendon and hamstring rupture. Hurts like crazy, but praying it eventually helps. Okay, good. Thank you, Lisa.
Simply the best. That's a good song.
Thank you, Lisa. Thank you for being here as always. What's your thoughts on berberine?
I love berberine for that. Yeah. I think it works as well as metformin. I really do. And again, of course, we use the GLP-1 GIPs for it as well because it's a disease of insulin resistance. But it definitely is. It says mild side effects. I've seen a couple of people that couldn't tolerate it because of loose stools, kind of like metformin, but not nearly as common as you will see on metformin. So I like it. I like berberine a lot for that. And good luck with the physical therapy. That's what you need.
Lisa, we're going to continue to pray for you and hope to see you back here next week with gives us another update. I have a question that a friend was asking me that I want to ask you on the show. Ivermectin, what is it? They're getting ready to take an overseas trip for around 8 to 10 days. What's your how would you dose the ivermectin? What's it for? Would you even do that for a trip that you're
definitely would.
out of the country?
Yeah, I definitely would. I'd take it You should always have it on hand just in case you do get sick with flu or COVID or any viral illness. Because I think it works. But certainly I would take it prophylactically, starting the day before you go on the plane trip, and then every other day while you're there. And I would use, we just use half the dose that we would use to treat COVID.
Okay.
I forget how many milligram per kg it is, but for an average sized person of say 70 kilograms, it'd be something you wouldn't need over like 15 milligrams. And if you get it, you double, take 30 daily for a week.
If you get like a COVID or flu?
If you got, yeah.
Okay. Okay.
And now you can tell if you've got it by easy testing.
And how would you describe, like, what's it for? What's it do? Is it for the immune system, or just like?
Oh, it's to treat viruses.
Antiviral.
Yeah. Uh-huh.
Okay.
It works through the microtubule system, and a lot of it, in the case of COVID, it allows zinc, which is, you need to take zinc with you too. You should be taking it every day anyway to get down into kill the virus. That's kind of one of the ways it works.
I'm going to put this up from Rebecca. Thank you, Rebecca, for this. What is your best supplement to recommend?
The overall best supplement, probably our super vitamin.
Yeah,
it has all the
figured that's
stuff
what
in
you
it.
say.
The 5,000 D with K, the absorbable form of C, 1,000. It's got all the methylated B vitamins. It's got vitamin A. It's got the natural form of E. It has zinc, boron, copper, a little bit of iodine. It's got lycopene, horsetail.
Let me put it up.
It's got no fillers in it. We don't put any fillers in our vitamins, and they have a 2-year shelf life. They're made and they're domestically sourced. They're not coming from China or India. So, yeah, manganese. I got about all of it right.
You got about all right. Yeah. Let's see if I can find out where, if I can hide this. There we go. Real quick, I like this question because, one, you've been wanting to do an episode on DMSO. DMSO.
I'm working on it.
Yeah.
I just got a new book on DMSO.
DMSO and ozone IV therapy. What would you recommend them for? That's a great question.
DMSO about everything, especially pain and inflammation, probably cancer. Ozone IV for cancer patients, for people that are chronically ill. If you have sores that won't heal, that type of thing. And also for mental acuity. The ozone IV therapy is pretty beneficial. I haven't gotten into doing it yet, just for various reasons. But DMSO it's just untold potential. If you really want to read about DMSO, just Google a Midwestern doctor and a thorough discussion of it, of what DMSO can do. DMSO is dimethyl sulfoxide, and it acts as a transporter vehicle, but it also has a lot of healing properties itself. But it's controversial. It's been around forever. The FDA doesn't like it because if you put that on your lower extremities or anywhere and wade through a cornfield with all kinds of pesticides, it could kill you because it brings stuff in. That's why it's so effective at bringing things in to cool off inflammation with joints, like combined with certain cortisone preparations, things like that. But it has also a lot of anti-cancer effects. It's just working the dose out. There's so many different theories on concentrations, all that. That's why I delay doing a podcast with it, because I don't want to put anything out there that doesn't have a lot more directions with it.
Yeah.
So, but read a Midwestern doctor.
Thank you, Rebecca, for that. And real quick, we're going to try and knock these out, and then we'll call it a show. Is there a trace mineral test?
Yeah. Mm-hmm. Yeah.
Just trace mineral? Is that what you're looking for?
Yeah. You can run that through almost any big lab.
And quick for Wendy. Thank you, Wendy, for this. Could I stop by your Bristol office and obtain a list of vaccinations you would recommend infants get or not get? That's we probably should, Wendy, because all my friends are asking. They call me and they say, "Hey, what would your dad recommend?" So many pediatricians.
You could stop by any of our offices and we'll give you a list of it. You know, it's probably going to be a blank sheet of paper.
But also,
if you do, it's a toughie. That's a real toughie. You know, very controversial. Whatever you do, just space them out. Just do the spacing out, and you know, make sure they talk to you about all the possible problems with them, and you know, definitely try to avoid the Hep B shot the first day of life. I don't know why they do that, but so there's a lot of controversy about it. But there are a couple books you can read. One is Vaxxed, Unvaxxed, and the other one is Turtles All the Way Down, written by a pediatrician. So just look at that and just try to do the minimal and space them out. I think a lot of the problem with it is they give too many at once. They overwhelm these poor kids' immune systems. But, you know, most pediatricians say that's heresy, but that's just the way I feel.
Wendy, thank you for that. And I see Whitway in here. Whitway, thank you for being over on Instagram for us. We love you. Let's do this real quick. So I'm on Zepbound, just wondering when I get to goal weight. Do I continue taking these shots at 15 milligrams weekly, or do I go to monthly or microdose? I love this question from Wendy.
You just go to microdose. Just work your way back down if you reach your goals, and work your way back down to the lowest dose that keeps your weight off and keeps you feeling good. But still a weekly, although some people go every 10 days. You know, I've had people do that and use a microdose that, you know, lasts you a good long time because this stuff's expensive.
Thank you, Brandy. And then for this, Teresa, yes, we do sell these to the public. So our vitamins are online, performancemedicine.net, and you'll see just our shops up there, our shop vitamins, and all the Dr. Rogers formulas are up there, as well as Digest Shield. So thank you, Teresa, for that. Performancemedicine.net, they are online and they're available to everybody. For Barbara, do you recommend the TDAPT for being around infants?
As an adult?
I'm assuming as an adult.
No.
Okay.
No.
And then this will be the last question, guys, and we're going to get out of here. What is the max dose of berberine I can take in a day?
Man, you'd
be careful with those because, you know, you can get nauseous, can't you? Or you go low.
Stools. Yeah.
Oh, okay.
I wouldn't take more than 400 milligram of it, I don't think.
Okay.
Remember, you get the dihydroberberine. It's just more absorbable. It's a better form rather than the berberine hydrochloride. Get the dihydroberberine.
Cheryl, does that help? And then creatine for seniors.
Love it.
Yeah.
They should all be on it.
All right, guys, that's going to do it for tonight. Thank you all so much. I'm going to turn off the podcaster here. Pop, you did great, man.
Thank you, man.
You did awesome. Thank you for that. You're going to take a bike ride?
Have fun in New York.
Yeah. Thank you. Guys, we love you. I hope I got to as many as possible. If I missed you, I apologize. We will be back next week. We do this every single Tuesday, 7 to 8 p.m., answering all your health and wellness questions. If you're new here, thank you guys so much for being with us tonight. We do this every week. We got so many in here that are regulars that make this show great. So hope you come back. Pop, I appreciate you, man. Oh, this is my dad, if y'all didn't know. Father, son, can you not see?
Same hat.
All right. Thank you, Instagram. We're heading out. We'll be back next week, next Tuesday. Thank you, guys. We love you. Looking for my outro from Brad.
Don't go away.